In our next topic, we're going to be looking at the career pathway for nurses. As you can see, with all the different specialties, opportunities are limitless. There are three main progressions that you could go through to start with. You could start as an assistant nurse and perhaps undertake a Certificate 3 course at TAFE. You may then decide to become an enrolled nurse, and this is a 1-year diploma degree, and that's where you're registered with AHPRA. Or you might go straight from Year 12 and be a registered nurse, and this is a 3-year Bachelor of Nursing degree. All of these will give you a wide range of experience in the healthcare setting. Now we're going to look at the different clinical pathways that you can take in your career, and we'll also look at the academic and qualifications that you might choose to do. So as a registered nurse, you've already undertaken your Bachelor of Nursing program. When you've chosen your specialty area, you might want to consider doing a graduate certificate in your specialty area, for example, graduate certificate in critical care emergency. Then you might undertake a Master of Nursing, and it might be again in your specialty area or as a broader research paper or subject. You might then choose to do a Doctorate of Nursing in your specialty area or PhD. For the more academic person that would like to go into the academic side of nursing and research, you would undertake your Bachelor of Nursing in Honours, and that's only given to the very top students. That gives you automatic entry into your PhD program if that's what you choose to do. People that take this academic stream generally become lecturers or become academics in the university sector. The stream for the clinical midwife is a little bit different to what it used to be. Before, you used to undertake a Bachelor of Nursing and then specialise in midwifery, but now you can go straight to a midwifery degree. And that will then lead you into a Master of Midwifery and possibly either nurse practitionership or a doctorate or PhD. And midwives are a little bit different because they can actually practice in their own right. So there's lots and lots of possible career opportunities, either in the clinical, the academic or the midwifery arena. Now we're going to look at the national competency and standards that all nurses must work within. That's the ANMC framework, the Australian Nursing and Midwifery Council. In order to be registered, people have to show that they are working within this framework. And we're going to go through each one of those areas now. So number 1 is professional practice. The nurses need to show that they can provide a wide range of professional practice. Number 2 is that they need to show that their care is ethical, and this is reflected in their journal or portfolio that they need to have for national registration. There needs to be evidence of critical thinking and analysis, and it also needs to show that you're participating in ongoing professional development of yourself and others. You have to show that you're involved in coordination of care and that you work within a multidisciplinary team. The nurses must prove that they have safe and effective evidence-based nursing care. They do this by showing 20 hours at least of continuing professional development per year, as well as clinical skills that they develop in their workplace. They must evaluate their progress as part of the interdisciplinary team, and they must maintain and appropriately conclude therapeutic relationships with all their patients. They must collaborate with the interdisciplinary team and provide comprehensive nursing care. So it's part of the nurse's role to work within this ANMC framework, and as we said before, as part of their national registration, you have to prove how you're doing that. Now we're going to have a look at scope of practice and what scope of practice is. So all registered nurses and assistant nurses need to work within their scope of practice. That is what they're allowed to do by law and by organisational policy and procedure. There are definite penalties if people work outside their scope of practice, and there might be times where people are actually asked to. But it's very important for the nurse to communicate very clearly that they can't do that they haven't been trained and they're not permitted to do it. It's also the responsibility of the hospital to ensure that there's an adequate skill mix. And what that means is that they have a range of skills amongst their staff. So that you can't have all junior staff on together. You need to have senior and junior staff so that those complex skills and complex care needs are given and there's someone that knows how to do it. So there's certain penalties that might exist, could be with the law, Organisational policy and procedure may be breached, so your organisation might impose a sanction. And APRA, the national registering body, might also impose sanctions and reduce your scope of practice. So nurse training exists to prevent people working outside the scope and ensure that the care to the patients is safe.